Guys, today I am coming to talk about cholesterol. Cholesterol is a very common lab that most people do, and when you go to your doctor, you should do it at least once a year or twice a year if they are monitoring it, but at least once a year you should have your cholesterol checked or ask your doctor to check your cholesterol. I'm going to explain to you what cholesterol is. It's when you have a fatty substance called cholesterol in your blood. That's what high cholesterol is. Fatty substance called cholesterol in your blood. What causes it? Mostly for most of us, sedentary lifestyle, smoking, inactivity, not exercising, drinking alcohol, family history. Family history is a common one. If you do have a family history of it, you can also get it. So it's good to watch your cholesterol, because too much cholesterol can cause a stroke later on in life. So there are things that you can do to lower your cholesterol. Some things like eating healthy, getting more exercise, sitting less. Sitting has become the new smoking. Many people sit for prolonged periods of time, and that's not good for your overall health. So, and some people, if it is very high levels, then you need to take medication. But if it is a small level or slightly elevated, they may tell you, oh, it's slightly elevated, we can change that with diet. If they tell you that, then you're at a good place where you can start changing your diet, eating less fatty foods, and that can decrease it. In that case, you'll be told not to do it once a year. They may have you go back in 3 months and they'll retake the cholesterol just to make sure, has it changed, has it decreased, or what is going on with it. If it is decreased, you don't need to get on medication. If it is high, extremely high, elevated, they may want you to get on medication to control it. It's easier to get on the medication and have it controlled than have it cause a stroke, because eventually it does cause heart attack or, stroke. Too much cholesterol, the thing it does is it blocks blood vessels. It blocks your blood vessels. So they have very good pictures online that can show where blood goes through, and the one that's a clean one and the one that has cholesterol. So the one that has cholesterol, the blood is not able to flow through as smoothly as the one that doesn't have cholesterol. So we need to work out and exercise a little bit and get our levels checked. First thing is to get levels checked, because if you don't get your levels checked, then you don't know if your cholesterol is high or if it's low or if it's within range or if it's too high where you need to start on medications. Get on your labs. Preventative care is very important. Most people don't do any preventative care. Lack of time, life takes over. But if you can prioritize it, then it's really good to get it checked. There are no symptoms. You don't feel any symptoms for high cholesterol. So that's why it's important for you to have the cholesterol checked. Then you can know that your cholesterol is high. But if you don't have it checked, it has no symptoms. It's not going to cause any symptoms that will tell you, oh, you know what, my cholesterol is high. So have it checked. Number one, preventative care. Like most other diseases, preventative care is better than controlling or curing the disease. So have it checked, check in with your doctor, and let them tell you what it is. Do labs on you. They'll tell you what it is. I'll go through some lifestyle changes that you can do. For most people, is exercise. Eat heart healthy foods. Lots of fiber. If you reduce saturated fats, then that is one of the things that you can do to reduce your cholesterol. Few changes here and there will make a big impact, especially if you're one that has been told that the cholesterol is just slightly elevated. If we do diet and exercise, then we're able to control it and we don't have to take medications. Reduce saturated fats, eat more fiber, eliminate trans fats, partially hydrogenated fats. That's what the vegetable oil that causes trans fats, that's what it is. So if we can do that, it will be like foods like what? Cookies, crackers, cakes. If you can reduce that, that's the most comfort food that most people enjoy. But if you can reduce that, that will affect your levels and they will decrease and you don't have to worry about getting on a medication. This is if it's slightly elevated. Eat foods rich in omega-3s, such as heart healthy foods with omega-3 fatty acids. Foods with omega-3 fatty acids are good for you, like oatmeal, kidney beans, lentils, Brussels sprouts, apples, pears. Such kind of foods, they increase your omega-3s and thus decrease your cholesterol levels. Increase soluble fiber. You can do that by reduce saturated fats. Saturated fats can reduce your LDL. You have an LDL and you have an HDL. The way to remember them, the bad cholesterol is the LDL. So remember it by L, maybe standing for lousy. So if that one is elevated, reduce your saturated fats, and that should help it coming down. Eliminate the trans fats, the cooked vegetable oil, eliminate that. Those trans fats raise cholesterol levels, unfortunately. So it's important to eliminate that. And then eat foods that are rich in omega-3, such as salmon, mackerel, herring, walnuts, and flax seeds. Those ones are rich in omega-3 fatty acids. Increase your soluble fiber. That's oatmeal, kidney beans, Brussels sprouts, apples, and pears. That will help decrease the cholesterol level. And then some people say add whey protein. If you don't have a milk allergy, then you can add whey protein. Some people who are sensitive to milk, most whey protein is made of milk substance. So it depends on how tolerant you are to it, but you can do that too. Exercise on most days of the week, even if you're walking. Even if you're walking 30 minutes a day, that makes a difference. So walk 30 minutes a day. If you can do 30, you can do 15 in the morning, 15 in the afternoon or evening, whatever it is that works best for you. That any kind of increasing physical activity will decrease your levels and will also help with your overall health. So it's important that we get into a routine, and whatever exercise is for you, not necessarily walking, whatever exercise that you enjoy, that you're tolerant to. Because if you take up an exercise that you don't enjoy, then it's hard for you to keep up with it. So take one that you enjoy and you're more likely to stick with it for longer. Taking a brisk walk daily, riding your bike to work, some people do that, or playing a favorite sport, whatever the sport is for you. Another thing we can do to reduce cholesterol, quit smoking. Smoking is a bad one. Once you quit smoking, within 20 minutes, your blood pressure improves. So for people who smoke, we can just avoid smoking, and that will help in many, many levels. Smoking also increases blood pressure. So it will decrease your blood pressure, but it will also cause your cholesterol to go down. So within a year of quitting, your risk of heart disease is markedly decreased. First things, maybe never start smoking. But if you're already smoking, then you can think of ways of quitting smoking. As hard as it is, they have support groups and everything that can help you through your journey of trying to quit smoking. Another way, if you're overweight or obese, then try losing weight by exercise, changing your diet, eating more fruits and vegetables, decreasing saturated fats, and decreasing any foods that are not good for you. That's how we can lose weight. Incorporate more activity into your daily routine is another way you can do. Sit less. A lot of us sit a lot during the day, so sit less. That should help you with movement during the day. So sit less, that will help you. Take walks during breaks or TV commercials. Some people during TV commercials, they stand up, they stretch or do something. Those little changes, they may not seem that much, but they will help you. Drink alcohol in moderation if you have to drink, but drink it in moderation. If you don't have to drink, the better for you. Then you don't worry about increasing cholesterol levels, getting all those diseases that come with alcohol. You don't have to do that. Too much alcohol leads to other serious problems too. Moderation is fine, but too much of anything, like anything else, even too much of sitting, causes you to be sedentary. So take it in moderation, or don't take it at all. If you're one of those people who doesn't drink, best for you. If lifestyle changes are not enough, then that's when they talk to you about getting onto a cholesterol medication, and you have to take it. It's a daily medication. You have to take it until it lowers your cholesterol, until they check the levels and they're normal. And then at that point, the doctor can say, your levels are normalized, let's try and take you off of it. But instead of us going through that, it would be just nice to get exercise, eat right, increase your fiber, walk daily, brisk walking, exercise, stretch, and then you don't have to get on the cholesterol medication. But that in a nutshell is cholesterol and what we can do to reduce it. If we don't reduce it, then we are at risk of getting a stroke, because if you look at the vessel, it's like a tube. For that person who doesn't have elevated cholesterol, the blood just flows through the tube. For the person who has cholesterol, part of the tube does have fat in it, So then the blood doesn't flow as well. They're very nice diagrams online if you do look at it. But it is a tube pretty much, which is the vessel. If your cholesterol is low, blood flows right through it. If your cholesterol is high, then you get to see part of the vessel is blocked by fatty tissue. So let's do that. Let's exercise. Let's increase at least one of them. Choose one of them. If you're changing your diet, start there. If you want to change diet, exercise, then do all of them. Increase your fiber, decrease saturated fats, exercise, eat right, stretch, commercial breaks during your regular work breaks. You can do that. That's all about cholesterol. We'll see you again on the next video. Bye-bye.